Today I will be presenting on postural orthostatic tachycardia syndrome, which is more commonly known as POTS. First, let's understand what POTS actually is. So POTS stands for, like I said before, postural orthostatic tachycardia syndrome. Postural means the position of the body, orthostatic means standing upright, tachycardia means increased heart rate, and then syndrome is just a group of symptoms. So at its core, POTS is a form of chronic orthostatic intolerance, which means it is a long-term condition where patients have a very hard time standing upright without experiencing symptoms. One of the biggest myths about POTS is that it is a cardiac disorder, when in reality, it actually is an autonomic disorder that consists of the brain failing to tell the heart to manage blood pressure and vascular tone. So why does POTS actually occur? First off, we have cardiac size. Because the heart is actually smaller, it pumps less blood with each beat, which results in a lower stroke volume, which brings us to the next point, stroke volume. So to keep enough blood moving to the brain and vital organs, the body has to make up for that low stroke volume by increasing the heart rate. And if the body's already prone to POTS, this compensatory mechanism goes into overdrive, which leads the body to and the heart into tachycardia. So next we have blood and plasma volume. When you stand up, gravity naturally pulls blood towards your feet. And if you already have less blood circulating, there is an even less reserve to keep the upper half of your body oxygenated. Also, people with POTS can be considered hypovolemic, which means that they have lower levels of blood circulating within their body to begin with. Second to last, we have hormonal fluctuations, which is more common in women with their menstrual cycles. Many of these patients report that their symptoms actually get much worse right before and during their periods. And the fluctuations in progesterone can cause the blood vessels to relax, which is more known as vasodilation, and can lead to even a slight loss of sodium and water through the kidneys, which further lowers the blood volume in the body, according to the ACSM. Also, POTS often triggers during major hormonal shifts, such as puberty or pregnancy, and the surge in hormones can disrupt how the nervous system communicates with the blood vessels. Lastly, we have vascular tone and venous pooling. So women actually tend to have more stretchy blood vessels and less powerful skeletal muscle pumps in their legs compared to men. So who actually is impacted by POTS? POTS mostly affects premenopausal women, which typically occurs between the broad age range of 15 to about 50 years old. Research done by Sheldon and colleagues highlights a significant gender difference, noting a female to male ratio of approximately 4-1 to even about 5-1. And in the chart to the left, you'll see that when there's clinical data shown, there's roughly about 500,000 individuals that have received a formal diagnosis, while experts estimate that about 2.5 million people actually remain undiagnosed or misdiagnosed today.
POTS is commonly triggered daily for many people. This chart shows some common triggers. The most common trigger is heat sensitivity. High temperatures are actually a major trigger for many patients. This is often due to the fact that individuals with POTS frequently struggle with poor internal temperature regulation. Next, we have prolonged standing. So probably the most recognized trigger is standing for extended periods of time. This often leads to significant symptoms like dizziness, lightheadedness, and possible physical weakness. Next, we have post-meal symptoms. So a less obvious trigger is the consumption of large meals. According to the ACSM, this leads to splenic blood pooling, I'm pretty sure that's how you pronounce it, where a significant portion of blood is actually redirected to the digestive organs to assist in nutrient absorption. And then finally, we have hormonal fluctuations. So, like mentioned before, the menstrual cycle is a frequent trigger for many women. This happens, this helps explain why the condition is more prevalent in females, as the condition involves vasodilation, blood loss, fluctuations in hormones like estrogen and progesterone.
While there are clearly tons of symptoms of POTS, the most common symptoms are a racing heart after standing, so about an increase of 30 beats per minute, and near fainting or blacking out, temperature regulation issues, and annoying headaches. Next, I will break down the common medications and treatments used for someone who has POTS. It is important to know that any of these treatments or treatments in general should always be prescribed by a medical specialist or professional. But according to the Heart Rhythm Society, there is a specific line of treatment that actually provides the best patient outcome. First, we have the first line of management, which is often the holistic approach. This typically involves increasing daily intake of sodium or fluids in general just to support the blood volume. So in this case, just adding an extra 10 grams of salt and adding maybe at least like 3 liters of water daily. Next, we have the traditional medications. First off, we have beta blockers. So when lifestyle changes aren't really enough, beta blockers may be prescribed. These medications work to blunt the heart rate response and essentially capping like the heart rate to prevent extreme spikes that POTS might actually cause. So another medication used is midodrine and fludrocortisone, I think, which are used to manage blood pressure and volume. For the best results, exercise sessions should ideally be timed to coincide with these medications when they reach their peak efficacy. And then finally, we have ivermectin. Ivor. It is an option that specifically inhibits the SA nodes like funny current, and this allows the body to effectively manage tachycardia without impacting someone's blood pressure. So it makes it a great choice for patients who only need to regulate their heart rate. Now let's understand some benefits of exercise for someone with POTS. Here are 3 great benefits of exercise when someone has POTS. First, we have heart growth. So aerobic training increases the left ventricular mass and the end diastolic volume, allowing the heart to pump more blood with less effort. Next, we have the blood volume increasing. Exercise actually stimulates the kidneys to retain more sodium and water, which naturally increases the blood volume, according to the ACSM. And then lastly, we have cardiovascular fitness, which improves. So improving the cardiorespiratory fitness reduces the perceived strain of daily activities, which also improves the VO2 peak. How might someone with POTS actually respond to exercise? According to the ACSM, individuals with POTS often experience a hyper-responsive heart rate during physical activity. This isn't just like a simple increase, it is a 30 plus beats overreaction to exercise stress. And this response is largely due to reduced stroke volume. So like I said before, because the heart is often smaller and blood volume is chronically low, the heart cannot fill accurately, and this is known as a low preload. To compensate for this lack of volume, the heart rate spikes rapidly to maintain a sufficient cardiac output. Next, we have gravity dependency. So the upright position typically worsens a lot of these symptoms that I mentioned before. To manage this, many patients adjust their routines to include supine or just like recumbent exercises. This shift normally helps them avoid triggering orthostatic intolerance while still getting the benefits of physical activity. And then finally, it is very crucial to monitor for a post-exercise syncope, so fainting. Blood pressure can drop sharply immediately after stopping exercise. It's a condition called post-exercise hypotension, which obviously can lead to fainting. So it is very important to make sure that you're monitoring and understanding that you need a longer cool down, essentially, to prevent blood pooling and fainting. Next, we have the necessary modifications needed for someone who is exercising with POTS. First, we have longer warm-ups. So according to the Levine protocol, it is essential to start an exercise or workout with 10 to 15 minutes of very low intensity movements. So using a rowing machine, a recumbent bike, or even swimming helps minimize orthostatic stress, giving the autonomic nervous system the necessary time to adjust before having a more intense workout. Next, we have to maximize plasma volume before a session, a patient should or a client should start drinking 16 ounces of water and consuming a salty snack roughly 30 minutes before the exercise. This proactive approach helps stabilize the cardiovascular response. And then finally, it is critical to avoid holding the breath during physical activity. Performing heavy lifts while using a Valsalva maneuver can create sudden pressure changes that often trigger palpitations or even just fainting with someone who has POTS. So it is very important to avoid holding your breath. Let's understand the necessary exercise tests needed to create a program for someone with POTS. Often referred to as the poor man tilt table test, we have the 10-minute stand test. So this is a passive orthostatic challenge that is highly reliable for clinical diagnosis. The protocol requires the patient to lie supine for 5 to 10 minutes before standing quietly, which is really important, for another 10 minutes. A heart rate increase of about 30 beats per minute or more, and about 40 beats per minute for those who are under 19, without a drop in blood pressure is a diagnostic hallmark of POTS. Next, we have the 6-minute walk test with a POTS twist. So while the ACSM recognizes that this is a standard functional assessment for many clinical populations, we apply a specific modification for POTS, which is focusing heavily on the recovery heart rate. So a delayed heart recovery where the heart rate remains elevated longer after a walk has stopped serves as a key indicator of autonomic dysfunction and an overactive sympathetic drive. And then lastly, we have the hand grip test. So the ACSM notes that isometric exercise can actually be really effectively used to test the pressor response. This often involves the patient squeezing a dynamometer at 30% of their maximum strength for several minutes. This test is vital because it can reveal an exaggerated sympathetic nervous system response, which helps us distinguish the hyperadrenergic subtype, where blood pressure often spikes. Next, we will have the exercise prescription that I have come up with for a person that I, of course, made up. So here we have Rachel Smith. She's a 22-year-old female. She's 5'6", 140 pounds, and BMI is 22.6. She was diagnosed with POTS 2 years ago. There's no other risk factors that we know of. She's been a gymnast for about 10 years, but has been inactive since she graduated college about a year and a half ago. And her goal is to improve cardiovascular fitness and maintain balance and core strength since she has been a gymnast. So Rachel's aerobic training will be 4 to 5 days a week. Her resistance and balance training will be 3 to 4 days a week. For the intensity, since her heart rate might not be as accurate with obviously extra monitoring and everything, we're going to try to focus on the RPEs of 11 to 14, so keeping it from moderate to high intensity. For the times for our aerobic training, we'll do a 10-minute warm-up and a 10-minute cool down for every type of training, and then just aerobic in specific 20 minutes of training. The resistance training, we'll do 4 exercises, 3 sets, 10 to 12 reps, focusing on muscular endurance.
And then the balance will do 2 exercises, 3 sets, 30 seconds to about a minute. Next we have swimming on nicer days and light rowing for aerobic training. For resistance, we'll do free weights, so a lot of single leg exercises and so forth, just because she obviously wants to work on her balance and all that fun jazz. And then the balance training in specific we'll do on Bosu balls and just balance beams, so more for realistic towards the sport she's known for her entire life.